Thank you, David, for this panel discussion and your facilitation. Thank you, Dan, for the wrap-up of what have been said until now. So now we would like to move on the famous call of action, what we call the Geneva Nutrition Initiative. And we would like to explore a bit the potential and the relevance of this initiative. And for that, I'm very pleased to welcome Francesco Branca on the stage. You, of course, all know Francesco. Today, he is an invited professor at Geneva University. But you know him because from 2005 to 2024, meaning last December, he was in WHO having high positions, and especially he was a director of the Department of Nutrition and Food Safety. I would like him to give us a bit of background about this initiative and what can be seen in the future. Francesco, you have the floor.
Good afternoon to all, and thank you very much, Valérie. I'm so pleased that I found such a beautiful new home here, and a wonderful family that is welcoming this idea. And I'm particularly happy that Valérie has given me this task to work on two words which I love. One is action, and the other one is nutrition. We have a decade of action on nutrition, so what best opportunity to bring those two words together? Nutrition, as you all know, is a source of a lot of emotions. We can celebrate successes, and we are still having such enormous challenges ahead of us. You heard Dan talking about the growing child survival crisis, just at the time when we were celebrating a success in the reduction of child mortality. But again, it's coming back. And this morning I was hearing about obesity, and Spain was celebrating a reduction of -2%. It seems small, but it's important in childhood because it's actually turning the tide, reduction in obesity rates. But at the same time, the dire perspective of going from the current 1 billion to 2.3 billion people obese in 2050. So, nutrition has to be the place where we take that action. Where do we take action? And of course, it has to be people-centered. So the action has to be where the problem is. The action has to be in the centers where children are presented with malnutrition. The action has to be in the primary health care offices where doctors find people with obesity. The action has to be where people are suffering from lack of food. Indeed, and that's, of course, the responsibility of people providing services and people who are making decisions about those services. But we also know that there are decisions which are taken in places where those people who are suffering the consequences do not have access. A lot of decisions are taken in places like Geneva, where governments or other actors convene and make those decisions. So I think I really would like to stress a point that also Dan made in his summary, and that's, and of course Afshan made in the first place, the centrality of public policies. So we need to believe in the importance of public policies, and we need to act where public policy decisions are made. Geneva is a very important international hub for that purpose. And let me give you 7 examples of why this is important. Health. We are having this week the World Health Assembly, discussions around the targets. The targets, had their influence on the nutrition agenda. Policy discussions around obesity, anemia, food safety, the development of strategies, and actually influencing the decision taken at country level. And in addition, we also have big actors in health, like the Global Fund of Gavi. Labor policies, Geneva is the place where the International labor conference is held, and discussion like maternity protection or workplace nutrition are taking place in those venues. We heard about trade. Nancy mentioned trade, absolutely important. Very difficult to penetrate the discussion at the WTO ministerial conferences. But as we all know, trade agreements have a major impact on nutrition. And there are policy options which can improve nutrition, being compatible with those broad policy directions the WTO is making. Human rights, of course, the Human Rights Council, and you know that we have a right to food special envoy, but we also have one on water, we have one on health, and important discussions on children's rights. I do remember important discussion, for example, on marketing to children being held here at the Human Rights Council. Migration, we heard migration, the Council of the International Organization of Migration. Refugees, we have the Executive Committee of the High Commissioner, and next door, climate change, where the Secretariat of the Intergovernmental Panel of Climate Change is being hosted by the World Meteorological Organization. So these are the venues. But we have the energy. We have the energy. Already Afshan and Dan mentioned the energy of civil society. The international NGOs we have here is remarkable, exactly in all those areas I mentioned a minute ago. But civil society is also the parliamentarians. Don't forget, we host here in Geneva the Interparliamentarian Union, where actually many parliamentarians who are visionary come here, and we've seen how they can cross-fertilize in their discussion. The energy of academia. This institute, the Graduate Institute, just to name some. Now, dialogues, importance of dialogues. I don't have to convince you about the importance of dialogues, but I just would like to acknowledge that, at least two organizations in this room have convened very important dialogues. I was really impressed by what World Vision and 4SD have done, convening 10,000 people in 54 countries, particularly a lot of young people, and bringing the conclusion of those dialogues to the Nutrition for Growth. So it's not just for the sake of being together. It's not just sterile talking shops. It's actually targeted meetings to have targeted advocacy for policy, building political agendas, being proactive on those political agendas and not reactive, but also being conveners here in Geneva of global discussions. We're not starting from scratch. As the saying goes, you stand on the shoulders of giants, and we did have a lot of good actions and dialogues already convened by WHO, FAO, SAN, 4SD. I really enjoyed the debate that was hosted by the SAN and 4SD last December, for example. So the structure for the dialogue is there. We have, a similar twin, I would say, a system in Rome. Next week, there will be a Rome Nutrition Week. That's another important venue. So can we do something here? And I think the purpose of this brief session now, and I'll hand over back to Valérie, is to hear from you, to hear what do you think about this. I mean, I think I've tried to give you the why. Now we have to discuss the what and the how. So in concrete, how would you do it? And we've been thinking in the past, and if we want to do it now seriously, we must move to the next step, and build on what particularly SAN, I must say, has been doing it, and doing it together for a purpose. So Valérie, back to you.
Thank you. Yeah. So we have prepared a few testimonies to get a bit your feedback. And we have asked 2 questions to those peoples. What interest should your organization have in the Geneva-based nutrition initiative? And do you see Geneva as the right place to host such a platform? And maybe we can start with Jessica. Maybe we can start with Michaela Serafini, she's the president of Médecins Sans Frontières. She's on the back of the room, Jessica. And she would like to say the few words on the MSF point of view.
Hello, everyone. Sorry, I make you go around, but maybe that wakes a little bit the spirit. Yes, I'm the president of Médecins Sans Frontières Switzerland, and I would like to give some words. The idea of having this Geneva-based initiative on nutrition is something that we support, and we support it because we see once and again, whether in South Sudan, whether in Yemen, how nutrition is put late in that comprehensive approach that we want to give to patients. And that is how well wounded don't heal. That is how HIV and TB treatments don't manage to be effective. That is how our diabetics or our hypertension people are having a nutrition that is not adapted to what we tell them they should. That is how pregnant women and children fall through the cracks when we propose a treatment that doesn't take into account their nutritional status. Because we see it once and again, we do believe that we need to make sure that nutrition doesn't come as an add-on, but comes as something basic as the other package of treatments, and is incorporated as one priority into that specific treatment, and not necessarily later in their visit or later in their treatment. When it comes to the second question, why Geneva? Well, we know that global health happens here. We know the actors that are present here in Geneva. There is a humanitarian hub here. Donors and institutions are here. Policies, financing, and even supply chains are drafted, are fine-tuned, are shaped in here. So we do believe that all the elements for it are present. Now, in that case, what we offer as MSF is also to bring the field reality. I heard that policies need to be closer to the field. I have no doubt they should be closer to the field, and what we can give you is that taste of what does it mean the field needs, the field necessities, and obviously also that idea of the advocacy that we can bring in, and the ideas of flexible systems that are able to adapt to the needs that are specifically in that specific point and for that specific patient. So as MSF Switzerland, we do support this initiative, and we look forward to participating to it. Thank you.
Thank you, Michaela. Maybe, Jessica, you can give the mic to Yvette, just in front of you, Jessica. Yvette Gonzalez is the medical director at Terre des Hommes in Lausanne.
Thank you very much. Thank you, Valérie, and thank you for organizing this event and for giving us the opportunity to participate. As most of you will know, Terre des Hommes is the biggest child's rights organization here in Switzerland. This is Terre des Hommes Foundation that is based in Lausanne. We have different activities. Health is just one of the programs. We also work in migration, access to justice, protection, WASH, which is a great opportunity for us to work in an intersectorial approach, as was mentioned today. And when we talk about nutrition, is definitely the way we do it. We work together with our protection and WASH colleagues inside the organization. On health, we are focused on perinatal health and health of children below 5 years old. Even when Terre des Hommes is not a nutrition specialist, is not our main focus, nutrition is essential to what we do because it's part of the topics that we take care of when we accompany pregnant women and newborns and also children below 5 years old. I don't need to repeat what was said more during the panel, but As you know, this is really important when we talk about health of children below 5 years old. For us, it's really, that will be really an honor to be part of a coalition, if I can call it like that, of different organizations working on nutrition. Is something that we want to support. From Terdesom's vision is also how we can bring new technologies and innovation to improve diagnosis and to improve treatment and to be more effective and cost-effective interventions, as was mentioned before. Why Geneva? I don't think I need to say more. I think Michaela already said that. I totally agree with her. So yeah, thank you very much again for the opportunity.
Thank you, Yvette. So after, I would like to give the floor to Mira Chidler, team lead at GAIN. Oh yes, she's there.
Yeah, we're all seated at the back, so make you turn your head around a bit. So yeah, so I'm here representing the Global Alliance for Improved Nutrition, and obviously nutrition is really important to us. It's in our name, and it's really at the core of everything that we do. You know, GAIN works in food systems. We work to improve food systems to have better nutrition outcomes. And we're at a state where inadequate diets have become the leading factor in disease and premature mortality in every country on Earth. Whether we're talking about NCDs or we're talking about undernutrition, it's really at the root is inadequate diets. So what interest does GAIN have? For GAIN, we really want to think about prevention. How do we improve food systems so that we have better diets so we can even prevent malnutrition from happening in the first place? I always think of nutrition a bit as a Venn diagram, where the three main areas are kind of like you've got your health, you've got your food, you've got agriculture. And what I'm really hearing here is there's a lot of other areas kind of that come into that Venn diagram as well. And I think, you know, we think of Geneva as being, it's like the health hub, but there's also a lot of other things that happen in Geneva. And, you know, the person who was here from IOM as well made me think of that. So I think it's also an opportunity to also help us break a little bit out of the nutrition community. I think like every sector, we have a tendency to talk to ourselves. And so I think this is an opportunity to bring those in that touch on nutrition, because nutrition touches on absolutely everything that we do. And it's an opportunity for us to reach out to the non-typical partners that we maybe wouldn't normally be talking to. I think one thing that I've observed since like the recent crises in our sector is that people have started talking to each other more. People want to partner up. We've talked a lot about how we need to be clever in how we work. People want to partner up. They want to collaborate. They want to think creatively. And I think, is Geneva the right place? I think we've covered a lot of that, yes. I'll add a little caveat though. Francesco talked about Geneva as a place for a convening role, but we have to make sure that it doesn't become a dictating role or a directing role. I think communities know their challenges and they know their solutions best. And I think our role here is to bring people together rather than to tell them what to do. And I think GAIN's very, very happy to contribute to that. And I look forward to seeing you all at the next meeting.
Is Alessandra Roversi in the room? Haven't seen her. Maybe not. So let's go directly to Bruno Lab. Bruno Lab is one of the members of our steering committee at Geneva Health Forum, and he would like to say the few words on the attitude of the Geneva Health Forum regarding this initiative.
Thank you, Valérie. Yeah, so I'm one of the steering committee member of the Geneva Health Forum. I'm sitting at the Geneva University Hospital. Geneva Health Forum has been created more than 20 years ago by the two founders, Geneva Hospital and the university, with the aim of having a platform which gives space, a neutral space for civil society, international organizations, policymakers, academia, on global health challenges, and trying to then set a place where dialogue is possible, connecting also with civil society groups and organizations operating in the global south. The initiative, the Geneva Health Forum, is supported by the two organizations I mentioned, Geneva and University Hospital, and Canton of Geneva, and as well the Swiss government. I think my message would be definitely that this platform is at your disposal. It's about creating the environment, favorable environment for having the nutrition being one of the team. We've been visiting a bit our strategy over the last years, and we are really trying to make this this platform a year-long event, and nutrition is definitely potentially, if there is enough partners behind, becoming one of the thematic. Thank you.
Thank you, Bruno. So if you would like to be part, here is the QR code to register. Feel free to do it. The QR code is here, but it will be also during the coffee break. That's it. And I would like to thank you for this afternoon. The Geneva-based Forum invite you for this coffee in the forum to follow our discussion and to start more networkings. You can imagine how I'm pleased as a nutritionist to have this discussion here and maybe to launch something as an initiative here. Thank you very much for that. I'm maybe not very polite, but I will ask you to leave quite quickly the room. It will be a bonus for me regarding Benjamin to clean the room and adapt the room for the next panel. Thank you very much and have a nice coffee and evening.